So I must say there are positive things and there are some negative things in this. So first of all, the whole world was exposed to this COVID for the first time, and nobody has got any idea about what to be done and what not to be done for these patients. So basically, many of these patients who were supposed to be diagnosed or supposed to be treated, they got their diagnosis as well as the treatment got delayed because of the COVID. We know that most of these oncology patients are immunocompromised, and top of that, we have no idea whether we can continue this chemotherapy in these individuals. Of course, there were certain guidelines from European Society of Medical Oncology and American Society of Clinical Oncology, American Society of Therapeutic Radiation Oncology. All these associations were giving a lot of inputs and guidelines. In spite of all that, there is a kind of a fear complex among the patients. So they delayed because if they come to the hospital, the fear is that they may pick up this infection. So that's why they didn't come to the hospital. But on the other way, I must say that because we had done more and more number of CT scans, like in the form of HRCT for COVID. In fact, we picked up a lot of individuals of lung cancer who were not having any symptoms. So that is, usually we don't see these kind of patients, that is early stage lung cancer patients in our routine practice, because we never ask for a CT scan if somebody is not having any symptoms about any disease. So that's how we picked up some early lung cancers. That's a bless. And of course, you know that these patients got delayed treatment because of various factors, like it's a fear factor among the patients, and infrastructure problems and logistic problems in the hospitals. And most of the hospitals were turned into a COVID center. So many of these patients were a bit reluctant to come to a COVID hospital. So that's how the whole story went on during the first wave. And second wave, of course, we were well equipped with many things like how to handle these patients and how to go about with these patients. But second wave was pretty bad, and we lost so many patients. I'm not saying about the oncology, but a lot of COVID patients we lost. So that was the major drawback. Of course, in this third wave, hardly you see any change among the patient's perception or this oncologist perception. So almost like it's a routine practice that we are doing, and not much of a change, except for using this COVID norms. We are not doing anything extra for these patients. That's it. I would say, by and large, cancer has got a very major impact on our society. In terms of many of these patients, they feel that it's a social stigma, and they never say that. Even if somebody is survived from the cancer, they never try to share that they had cancer. So that's the kind of an stigma this cancer carries with the name. So as a whole, if you look at the burden, I think the cancer burden is increasing day by day. Almost, I think close to it has become like the second most common cause of a death in Indian scenario. And if you look at the statistics, it's growing like anything. Previously, we used to see that and occasionally somebody who is far away or far relative of us suffering from cancer. But today you see in your own street or a neighbor or your own family member, somebody or the other is being affected with this, because the magnitude of the problem is increasing like anything. And I think the present infrastructure will not be sufficient enough to tackle the number of cases at what pace it is increasing. we won't be able to do justice to the patients unless we increase the number of centers available for the catering the treatment for cancer patients. Of course, physical, I don't know what kind of an physical stress impact it will have on the society, but emotionally, definitely it will just pull down somebody's emotions, but emotionally it has a very major impact. The whole family will suffer from a lot of emotions, and the individual itself. And the major problem what I see today is, what we were thinking that cancer is a disease of elderly people, that means old man, that's somebody who is more than 50 years or 60 years. But today I see a lot of young patients coming to me with between 30 and 40 years. So, and they are the breadwinners for the family. If a breadwinner of the family is affected with the cancer, definitely they go through a lot of emotions, and it is very difficult to tackle that. That's also another factor that we see with cancer. I think these are the main things. And mentally, of course, they go through lots of phases. Like initially, when you say that the word that you're suffering from cancer, and then will be a shock, and then they'll go into depression. That's where you require a lot of support from the family members and your spouse. So if there is enough support from the spouse and the family members, definitely the individual will come out. And basically you need to create a positive aura around the patient. Then the things are going to be really good for them.
Yeah, perfect. Thank you, sir.
Government has got various plans, like of course government has to take some stringent rules, and of course we do have certain rules, but we don't see them getting implemented. That is the hardest part as far as government rules are concerned. But and we are the first people to violate most of these government rules. But the thing is, like the government action, see, the thing is, like they have to have a certain kind of an control on the advertisements, and they have to have certain control on list production and this thing, tobacco. Of course, we do see that the chewing tobacco, what is called gutka or pan parag, whatever, is been banned. But at the same time, every day you see it in the paper that somewhere in the corner of Visakhapatnam or Vijayawada or Hyderabad or Rajahmundry, somewhere somebody has been caught with gutka packets of worth of 10 lakhs or 5 lakhs or 2 lakhs or whatever. So that means there is a production, and the only thing is you have implemented a rule that it should not be sold in the shop. But why is it you are allowing the production? But if you have that strict stringent punishment for that, definitely nobody will come forward to produce these kind of products which are really harmful for the public. So that is somewhere I think we have to look at, and the government also has to look at. And accountability, I think we are not the people to talk about that, but definitely there's not much accountability as far as these kind of practices are concerned. So that's where we take it very light. So somebody gets arrested and he comes out of the jail next day. So how can you say that? So this is where we are unable to control certain things. Of course, the rule is good, but implementation part is not so good. So that's where we have to probably improvise ourselves in this. Yeah, this is basically, I think this is what the theme for this year at next year, and going to be the theme for the next years also. That is the close the care gap. The reason being close the care gap means every individual has got right to get the right treatment for the disease, whoever is suffering from cancer. Every individual has got. So that unequality has to be totally removed. And as far as reducing the gap you need to improve the skills. You need to improve the skills of the professional, and you need to improve the standard of care. You need to improve the infrastructure. You need to improve facilities, in number of facilities. So right from it is like a bit complicated issue. Like, you need to have more number of centers. You need to have more professionals with skills. You need to have much more infrastructure to tackle and close the gap that is been there for delivering the treatment for cancer patients. So as far as improving the skills are concerned, there are certain NGOs where they give a specialized training for your advanced techniques, where you can get yourself trained in robo, yourself trained in laparoscopic surgeries and all that. So this is available, and I think more and more number of youngsters and the more number of professionals should utilize this platform to learn more, and then so that which can be practiced on the patients, and you can improve yourself as well as the care, so patient care. And second thing is infrastructure. So definitely the infrastructure in the hospitals has to be improved to the next level, so that patients should not think that I have been given an inferior treatment in a remote place because it was not available, so I had to go through. So that kind of a concept should not be there among the patients. So at least the minimum treatment should be available for the patient for the particular cancer in a district hospital. Then only you will be able to do justice to the patients. So that's where you can improve yourself as far as patients care is concerned. And the other thing is number of centers. Definitely the number of centers that we are having today will not be good enough to cater for the numbers that they are increasing. So I think we need to improve number of centers so that it should be freely available for many people, so that they can get the treatment easily. See, basically, I think the major challenge is that your perception and your thinking. Once you have that in your mind that I want to learn this, I want to do this, I want to go about this, and probably I think we have enough patients data, enough patients number, and we have enough infrastructure to do all these things. But the only thing is, not many people will think about to do more innovative things, and that is the major challenge. And the second thing is adaptation for an innovation. Say, for example, I was doing my treatments on a cobalt, which is like a good old technique or a good old machine. So 25 years ago. And today I'm on a platform where that's on par with any international cancer hospital. We have a linear accelerator. We have surface guided radiotherapy, which is the best in one of the best centers in India. But only thing is, but for that I had to work a lot. I had to learn. I went abroad and I went to another center to learn. So once you learn, you have to make people also to learn with you, because it's not just you alone is good enough for your center. Because now I have to train my technicians, I have to train my physicists, I have to train my subordinates, so that everybody will understand, and everyone put together can deliver this treatment in a better way. Because knowing by a single person alone is not going to really help anyone except for that individual. If the entire team is totally trained, that's going to be a good thing. But that's where the challenge, because not many people will come forward to train the entire team, because there will be a lot of financial implications and resources and implications and the logistic things. So I think the institute has to move forward to train the entire team, so that the team can deliver in a better way than an individual. That's where I feel that is one thing which we have to adopt ourselves. It's very difficult to adopt, but we have to. That's one thing. One thing is the cancer care is going to improve, and it has improved in India over the last 25 years. And I have seen, I have witnessed, there's no doubt about it. And the techniques which we thought that we won't be able to practice in our life are available today, and we are able to do it, and we are doing excellent work on the patients. And the second thing is, you have to clear the fear of cancer among the public. Public still feels that it's a of course it's not a simple disease, it's a major problem, but you have solution for that. And people needs more awareness about this. People need more awareness and education about this cancer, and they have to come forward for an early detection. Definitely the early detection of cancer is going to help the patients, and all the clinical research or whatever what is being done today is going to be practiced tomorrow, and that's going to really benefit lots and lots of people. And there are so many new drugs are coming in the pipeline, which are specifically acting on a specific area. So that means we are not trying to give a treatment which is called a generalized or a blanket treatment. We are trying to deliver today our treatment in a personalized manner. That means what the patient characteristics and the tumor characteristics, accordingly we are trying to deliver the treatment. That's where we have achieved. I think that's good enough, and I think the way we are progressing is really encouraging and inspiring to all of us. And these gaps can be easily closed once the professionals come forward to learn many things. Like people who are practicing in the periphery can come forward to learn many things, and then they can practice in their place. And so I think there should be a more kind of a communication among the specialists and the super specialists and the downline general physicians, so that if that connection is there and if there is an exchange of data among those people, I think definitely things are going to be